Preventing iatrogenic chronic neck pain and disability. Prevention is better than cure. Hello, I'm Byram Jam and thank you for joining me. Iatrogenic refers to an illness inadvertently caused by examination, treatment, or comment provided by a healthcare provider. Yet one of the basic principles of medical intervention, as stated by Hippocrates, is first do no harm. Let's talk about arthritis. Arthritis is a term readily used to explain to patients the cause of their pain and stiffness. In this presentation, I fully acknowledge the existence of conditions from rheumatoid to psoriatic arthritis, and I'm fully aware of the possibility of severe forms of osteoarthritis where a diagnosis is essential for appropriate medical management. However, you have arthritis is too often willy-nilly told to vulnerable patients who present with aches or pains in a specific part of their body. All that is needed to give that awful diagnosis is pain, stiffness, and some mostly coincidental radiological findings of joint degeneration. All healthcare providers and primary care physicians need to realize that by giving the arthritis diagnosis to a patient, they have potentially doomed them to a lifetime of pain and disability. In other words, they may have unintentionally caused iatrogenic chronic pain. Let's explain BARF and vomit. All healthcare providers must discontinue the act of BARF, which is the bad application of radiological findings. Let's say a patient is complaining about their persistent neck pain and stiffness. They are then referred to receive an X-ray. When the X-ray report shows signs of degenerative changes, the patient is confidently told in a gloomy voice, "Your X-ray result has come back and shows that you have arthritis in your neck, which explains your neck pain." The general public has such a negative perception of arthritis as just being diagnosed with it brings about thoughts of getting old and having to live with permanent pain and disability. You don't believe me? Just Google neck arthritis and see the crap that comes up scaring the daylights out of people. Seriously, how can any healthcare provider be in any way confident that a patient's neck pain is truly related to the degenerative findings seen on an image? That is BARF in action, meaning the bad application of radiological findings. If all degenerative changes in the neck resulted in pain, then 98% of us would have neck pain that would persist for the rest of our lives. After a trauma, such as a motor vehicle accident, patients who receive MRIs are frequently informed of the horrific findings, such as disc bulges found in their neck, presumably caused by the accident. This inevitably results in greater fear avoidance beliefs, catastrophization, stress and anxiety, which have all been strongly associated with the development of chronic pain. A potentially benign condition is converted to a persisting and disabling condition. No thanks to the nocebo effect. If all disc bulges in the neck resulted in pain, then 3/4 of us would have neck pain for the rest of our lives. And that's simply not true. What is true is that when people are told of arthritis or disc bulges in their necks, they have a greater number of visits to various healthcare providers to fix their damaged neck, greater use of pain medications, and greater likelihood of receiving injection blocks. Some of you may be familiar with my victim of medical imaging technology, or better known as the vomit poster, that I've done my best to distribute to all clinics and hospitals across Canada. This is the cervical spine section of the vomit poster. An MRI study of healthy adults and seniors found that 98% of all men and women with no neck pain had evidence of degenerative changes in their cervical discs. In addition, among healthy, pain-free young adults in their 20s, up to 78% have been shown to have disc bulges. A 10-year study compared the MRIs of healthy people to those with neck whiplash injuries. Both immediately and 10 years later, Both groups had similar MRIs with 3/4 having neck disc bulges. Translation: the far majority of all healthy adults get neck degeneration, arthritis, and disc bulges, meaning they are a normal aging process. Therefore, neck arthritis or mild to moderate disc bulges cannot possibly be a reasonable explanation for your neck pain, or else 98% of people would have neck pain. Basically, the bad application of radiological findings, or BARF, results in patients becoming a victim of medical imaging technology, or vomit. All healthcare providers may help reduce iatrogenic chronic neck pain by eliminating the BARF. My ultimate wish is for a medical regulation to be passed that all radiology reports must include epidemiologic information in imaging reports regarding findings in asymptomatic individuals. Simple 1 or 2 sentences to inform physicians and patients the normative ranges. Why not? Normative ranges are always clearly stated with blood work lab results. In summary, for the vast majority of times, healthcare providers can replace the term arthritis with healthy age-related changes. Do not tell patients this. Your x-ray results came back and it shows that you have some arthritis in your neck, which explains your neck pain. You need to take it easy from now on to prevent further degeneration. You just have to live with this. But tell patients this. Your x-ray results came back and it shows that you have some healthy age-related changes. And the good news is that the vast majority of these changes aren't associated with pain. You need to stay active and gradually add upper body and neck strengthening and movement exercises in order to make your neck more resilient. A good physical therapist can help you with that. This is my 94-year-old grandma. She has never complained of neck pain to me, and I've been her personal physiotherapist for the past 30 years. There's no doubt that she has severe degenerative changes and several disc bulges in her neck, yet no pain or discomfort. Patients must be made aware that degenerative disc changes are not a life sentence to experience pain. This is a part of my video series called Preventing Iatrogenic Chronic Pain, available in the video library on APTEI.ca. I really look forward to telling you more about my grandmother and her role in preventing iatrogenic chronic pain. I'll personally mail you a free copy of the Victim of Medical Imaging Technology, or better known as the vomit poster. You may request one on APTEI.ca Clinical Shop. You can also freely access the high-resolution image file of the vomit poster and print it out yourself. You may access it on APTEI.ca under Pain Education. I would be extremely grateful if you shared this video with as many healthcare providers as possible, such as MDs, including family physicians and orthopedic surgeons, PTs, chiropractors, osteopaths, and RMTs. It's up to all of us to spread this message and help end iatrogenic chronic pain and disability. If you have any questions on this topic or need references, or would like me to present this information live to your clinic or hospital staff, please contact me. Thank you.